Hello, can you hear us? Can you hear us? Can you... Over. We are sinking. We are sinking.
Hello? This is the German Coast Guard.
We are sinking. We're sinking.
What are you thinking about?
So actually, you can excuse my accent now. So actually, I'm very happy. Thank you very much for the invitation to be here. And what I'm planning to do, actually, to present, to give you a bit of taste what I have done with IntraHealth in Senegal in 2008 as a Global Health Fellow. Also, I want to say that everything we heard this morning it's true. Every piece is part of the solution to help people in the world. So right now, I'm gonna just want to give you a bit of what happened in Africa in 2008 when I was there with a partnership with Pfizer and IntraHealth Senegal. IntraHealth, it's amazing. Like to hire me, I looked at the value and I said, this actually fits my value. So, and I will tell you what happened on the field as well. For Pfizer, actually, I was part of what we call Pfizer Global Health Fellow. Actually, Pfizer, because we don't have medication to send, let's say my mission was on malaria. So they send people with skills to go and help. So right now, about 300 people went to actually help with their expertise to strengthen the healthcare delivery in the world, so that every part in the world. So I think that's a great things we're doing. IntraHealth and Pfizer in Senegal, we did amazing. I'm going to show you, and actually we were also listed as in the Clinton Initiative as one of the biggest impact. That's a bit of fact about malaria. As you know, malaria, it kills so many people in Africa and around the world. And during my presentation, you can count how many people will die from malaria. So it's a quite serious disease. Some things also you should know about malaria. You can treat malaria, but you have to have access to the drug, to the medication, and right away. If you're diagnosed with fever, you go and get treatment. In Tambacounda, it's actually east part of Senegal. We did a baseline assessment, and only 1.3% of the population. We actually surveyed about 303 households. Only 1% of the population was able to get access to treatment within 48 hours. And when we went, because we have our 4x4, and we went to see the village people, the villagers, we saw so many people dead on our way, child. And the way they actually bring the kids to the hospital, if you have money, you rent a donkey and you go. And it's a long, long journey. It takes about 1 week to go actually to a hospital. So the mission was actually to bring healthcare closer to the population. As you can see, our intervention was at the community level, right here. So because people cannot get treatment on time, we're gonna bring the treatment to them. So we actually work on community health workers and community health volunteers. Community health workers were actually the health hunt with a biggest population, and community health volunteers are polarized village. Around this big village, you have little village. So what we did there, we did education, health education on malaria. So this is actually what I explained. So what we did at the health hunt, we introduced the rapid diagnosis test for malaria. So we train one village volunteer to diagnose, treat malaria, and prevent malaria. So we did that. We provided them with medication, with also, because talking about innovation, you see, you have to take some risk. We were the first, IntraHealth and Pfizer, to introduce the rapid diagnostic test at the village level in Senegal. That saves life. Like, that tells you that you have malaria and you should get treatment. What we did also, we did also health delivery. We trained matron to give birth at the village, so she doesn't have to go and give birth. So that's some things we did as well. It was part of the malaria national initiatives. So the government was very happy about what we did there. We actually provided equipment to the village. We also educated everyone on how to, what is malaria. The thought that malaria was coming from the milk. So that's not true. You know, you have to train them, educate them, and try to avoid malaria as well. That's the mission for a 5-component, tough component, but we did it. We have to engage. We didn't work ourselves. We work with the existing public health infrastructure. So we went through the public health infrastructure, to actually, so that we can ensure the project can stay sustainable when we're gonna leave. And people were engaged. When people are engaged, we're gonna do great work. So I think that's the key things there. So we spent talking about the mission there, we educated and we engaged all the local communities. We did also consultation. We created synergies around NGO in the area. So Africa was working at the health post, the nurse health post. We are working at the community level. So we're making sure that we communicate to and we target everyone there. We did health hunt activation. This is what I said. We made health hunt functional. We trained a community worker to treat, diagnose, and prevent malaria. It was not easy to educate someone with a low grade of education to how to diagnose and give the right amount of medication to a child. So that was quite challenging in local language as well. So we did that. We did education. We did malaria campaign also. Two biggest campaign on radio station. We targeted men because men take the decision in Africa, in this region. So we have actually to educate men about that as well. And we did also, we monitor our success and we adjusted when needed. What are the impacts? I think it says it all. In 6 months of my life, we were able to reach about 76,000 people. 12,000 children have access now to treatment for malaria, promptly access to treatment. We introduced the rapid diagnostic test at the village level. That was highlighted in the journal. Actually, I was called by UNAG, I should not say that, but by the Wall Street Journal. I did not follow up, but I have to, I have to do some things about that. So, and we were the first actually to talking about risk also. The first woman community worker in that region, it was because of us. We took her, we took the risk to educate a woman. She's the one there treating her population. I remember when we went to the village, we went to see the village council. She had the highest level of education. I said, I'm gonna train her. People said, no, 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 that's never happened here, it will never happen. I stood up, I said, if you don't want, I leave. I'm here to treat your population, I'm here to help you, so you have to give some things in return. So it was quite challenging for me because I have to follow her, train her, and then we went, and the journalist went and actually interviewed her, and she was doing a great job. She's saving life there in her village. And we got also an award from Pfizer to the success of the mission. Before I just want to end by saying that it was really tough. 125 Fahrenheit for 6 months. Barely no food, no water. I got malaria for 1 week. I had the medication, so I knew how to use it. So, but it's not fun at 125 Fahrenheit. So what kept me going, or what kept me going there actually is I think passion. You need to be passionate. If you have passion, nothing can stop you. Secondly is the villager, their spirit, their strength. They have nothing, they're happy. So that's something kept me going. And finally, IntraHealth, their support was amazing. So thank you very much for that. That picture, I'm not lying. I was we were heading to Dakar, taking my plane back to Canada. It was a raining day, but I said, let me have a last look of Tambacounda. I went, I turned, this is what I saw. And honestly, I think this is a light in the heart of the people there. So thank you very much for that.
Thank you, Anthony. I'm Babacar Gueye. I'm the country director of IntraHealth Senegal. And I will try to improve my English. I will just focus on what happens now. This project ended on 2011. And what we noticed is that malaria has decreased from 24% to 6% from 2008 to 2010. And the most important result is these community health workers we trained in 2006 are now able to treat malaria, to treat diarrhea, to treat acute respiratory infection, and to provide some family planning care to their own community. And sustainability is one of the issues of many projects. But with this project, we really succeed to make this project sustainable. And the reason is just partnership. We have a wonderful public-private partnership, but Anthony was a bit humble, but Anthony has already a strong partnership with the community. This project was designed according to the need of the local community. That's the reason why this project continues to be successful, even if we don't have resources. Thank you, Anthony, for allowing thousands of people to have access to malaria care and treatment. Thank you.
Thank you very much. I just want to say that the Global Health Fellow is actually celebrating his 10 years anniversary, and is also proud to support the silo buster context. And these actually are the new generation of Global Health Fellows going to make a real impact on the world. So.
Hi, DJ. Someone special to announce?
College students everywhere were invited to submit a silo-busting switch point that could have a real impact on the world, and I am here to announce the winners, which is a thing I like to do. The contest was made possible by the generous support of Pfizer's Global Health Fellows Program, now in its 10th year of programming, being a true switch point for making the world a healthier place. Now the judges, these are the people who had the very tough job of figuring out which of these student projects would win. It was Jessica Colico from iHub, it's Casey Kaplow from Good, Josh Nesbitt, who you saw this morning from Medic Mobile, Tembi Maguri from IntraHealth International, Una Puglisi from Pfizer Inc., and Aaron Sherinian from the UN Foundation. Those are the judges. And the three winners were selected. There is a tie for second place. They're each here to share their winning ideas. And up first, one of those tied for second. This is Jordan Skemmerhorn.
Hi, my name is Jordan, and when I order things online, I become just dramatically impatient. I check the tracking system every day. But this is nothing compared to mothers in the Gaza Strip when vaccines are out of stock. So Gaza gets vaccines through the West Bank, unless they don't, usually due to trade disputes. And when this happens, parents who are waiting know that everyone else is waiting too, and so they call in to check every single day. And each day a nurse is removed from the typical task of caring for patients to answer about 150 of these phone calls. But right now, all the clinics in Gaza are in the process of switching over to electronic records. And we can use this information to sort the children who are waiting for the vaccines by how long they've been waiting and to schedule their appointments automatically. They also have the cell phone numbers of all the parents who keep calling in. And we can import these into a mass texting system that would enable clinics to automatically alert parents as soon as the vaccines come in. And eliminating those phone calls could save about 175 hours over the course of a 10-week shortage. So the causes of these supply disturbances here and elsewhere are really complex and varied and difficult to fix, but a little bit of tinkering can make the waiting period and the aftermath a whole lot easier. Thank you.
Thank you, Jordan. Up next is Babacar Gueye, also tied.
Hi, everybody. My name is Vivek. I'm an MPH MBA student at the Johns Hopkins University. I'm working on this project called Okati, which means medicine in Nepali. And our idea is to use information technology to improve the healthcare delivery service. We are trying to create a common platform that can be used by all the stakeholders to share and access information. And the way we're planning to do it is, first we'll collect all the information that is available in the government database and reports, and we'll put them together into one platform. And over time, we want to collect more information from the government and from academic centers, start putting them into our platform, and slowly integrate more information and give permission to the users to add more information. This is the platform. This is the architecture that we are working on. We have started mapping the facility, as you can see on that corner, we'll add more information about each of the facility, like the financial resources, their human resources, their health outcomes, the number of patients they treated, and we want to give permission to the users or people in the district that can fill in the gap in that information. And we also have a program called Ask a Doctor, and we're also creating a healthcare portal where all the information can be brought together for the users. I think my time is up. Quickly, I'm pretty easy to find with my gray jacket and my bald head. Please come say hi, give me feedback, share ideas. Thank you.
Thank you very much. I was just trying to get through algebra in school. This is amazing. And now our winners are Vishy Jagannathan and Elizabeth Chen.
According to county health rankings, Northampton County ranks 90 out of 100 NC counties in terms of health outcomes.
That means that in North Carolina, 90 counties are healthier than Northampton County.
And here, girls aged 15 through 19 are 3 times more likely to get pregnant than the average American teen.
So when I've had questions, I just look them up on the internet or ask my teachers. In the past, I've had health teachers that did not seem to inform themselves. If our teachers and educators are not informed, how can they teach us?
We want an online curriculum that is made for us, that engages us, and that actually helps us make healthier choices.
We deserve an excellent health education tailored to our health behaviors.
Here in Eastern North Carolina, quality health education is lacking. There's also a distinction between health knowledge and health behavior.
Traditional curricula only focus on monitoring knowledge, but what if a new online course could monitor both health knowledge and health behavior in real time?
Students will take surveys at the start of the course. Each student will then receive a tailored set of lessons and tools that are aligned with North Carolina Healthful Living Essential Standards based on their initial responses.
The curriculum will increase learning and behavior change in a stepwise manner grounded in health behavior theory. This curriculum can be used and adapted throughout the state, especially in low-resource schools.
Since counties throughout the U.S. and developing countries have similar health disparities, we strongly believe that this curriculum can ultimately change health outcomes around the world.
So again, my name is Liz.
I'm Vici.
So since we submitted this entry, we reached out to professors at the University of North Carolina School of Public Health and the School of Education who are interested in evaluating the process in addition to the health and education outcomes that would come out of My Health Ed. My Health Ed will be a tailored online curriculum, so we will collect a unique source of data which currently doesn't exist. And this data will then be used to look at patterns for health behavior, especially in students in low-resourced areas.
We also have a partnership with Teach for America, and that gives us immediate access to a network of high-need public schools in 11 counties in Eastern North Carolina. By hiring TFA core members, those counties have already demonstrated this deep commitment to seeking out alternative ways to improve the health and education outcomes for their students. So being that we're both members of the Teach for America community, we see this tremendous opportunity to partner with those schools and then have a direct impact on those students.
And also by August 2014, North Carolina's Department of Public Instruction will be rolling out online modules for all courses in K through 12, including health, which means that North Carolina, in addition to other states, are on board for this online education. So we really feel powerful, and that now is the time for us to transform health education and take it online.
So right now, we really just want your feedback. So please come talk to us today, tomorrow we'll be around. After that, you can definitely email us up here, follow us on Twitter at myhealthednc. We also created a little handout that kind of details what we just talked about, and so you can grab that on one of those tables out by registration. And then we're working on getting a Kickstarter up to raise some funds. So please join with us, support us, and help to ensure that one day all children will have the opportunity to attain an excellent health education.
Thank you.
Really big round of applause. That's amazing. All of you. Great work. And thanks to Pfizer. I think the future looks bright. Here we go.